Hi, I'm Kuzemko. I'm a sales exec at Cloud Gateway, and I've been at Cloud Gateway for 3 years, and I specialise in health and the HSCN. So the Health and Social Care Network is essentially an upgraded form of N3 and was launched in 2015. It's intended to provide a solution for hospitals, medical centres and GPs to collaborate and access services over a single, secure, high-speed network. Unlike the N3, which was solely run by BT, the HSCN give customers a choice over who they want the network provider to be. It also promotes choice and competition across health services available on the HSCN and is seen as more of like a marketplace or platform than a bog-standard network. The HSCN allows organisations to access a wide range of services, from essential NHS England applications like NHS Mail to services like Spine, EMIS and System 1. It's a rich community of resources from both public and private health organisations. And for many organisations, a connection to the HSCN is essential to their daily operations, their ability to innovate, or both. CNSP stands for Consumer Network Service Provider. CNSPs are suppliers like Cloud Gateway who are permitted by NHS England to sell HSCN connectivity. Accreditation involves a detailed audit process to ensure that our network and service management processes are reliable and secure. And currently there are 21 CNSPs accredited. You'll find that the list of CNSPs consists of predominantly large telecommunication companies, and we genuinely find that they can be expensive, slow to deploy, and offer poor customer service. At Cloud Gateway, we differentiate ourselves by being able to deploy connections rapidly and affordably, and those solutions are wrapped up in a responsive and friendly managed service. An HSCN CSP, Cloud Service Provider, is different from a CNSP in that they cannot sell pure pipes connectivity to the HSCN to their customers. Instead, a CSP is a supplier that has its own HSCN connection and builds some kind of value-add service or software on top. Customers who purchase from a CSP must buy the connected service and share the CSP's HSCN connection, rather than buy an HSCN connection for themselves. You don't need to be an NHS organisation to connect to the HSCN. Private IT suppliers are part of the health community and are also able to connect to the HSCN. As long as you get your ODS code and you sign up to the terms of the HSCN Connection Agreement, you can obtain a connection from us. You can connect to the HSCN from outside the UK, but there are rules. IT service providers outside England may obtain HSCN connectivity from a CNSP to deliver their service to users. However, their company must have a presence in England in order to apply for an ODS code. Data must be stored in the UK, European Economic Area, or an adequate country deemed to have an adequate level of data protection by the European Commission, and users consuming the service must be based in England or the devolved nations. An ODS code, also called an organisation code, is a unique code created by the Organisation Data Service within NHS England, and it's used to identify organisations across health and social care. An ODS code is needed to access a range of NHS England services, including the HSCN. It is likely that you already have an ODS code, especially if you work in a public health organisation, or you can find the link below this video. If you can't find your ODS code, or you know you don't have one, this means you don't currently exist on the Care Quality Commission database. You'll need to contact the Data Security and Protection Toolkit Help Desk to register yourself, or we put the contact details below this video. And then once created, your details will flow through to ODS and be published as part of the social care files used across the NHS. If when you look up your organisation that some of your details are wrong, you should email the Data Security and Protection Toolkit Help Desk, and you can find the details down below. An HSCN Connection Agreement must be submitted by any organisation that wants to send or receive data across the HSCN. Detailed information can be found in the link below, but essentially the Connection Agreement is a promise that you will use the HSCN for the purpose it was intended and will follow the information government standards and data security best practice that's set out by the Data Security Protection Toolkit. You can check if you have an HSCN Connection Agreement by searching your organisation at the link below, and then you can see if you already have the agreement in place. You can complete a connection agreement at any point before you connect to the HSCN. NHS England advises that you do this as soon as possible to make sure that you don't face any connection delays. In order to submit a connection agreement, you'll need to provide the following details to the email in the links below. So you'll need the organisation name and address. This should match the information held against your organisation's ODS code. You'll need the ODS code. And you'll also need the name and email address of the HSCN point of contact. This should be the person responsible for completing the connection agreement. Once NHS England have received all of this information, they will then send an invite with registration details by email to the nominated contact details. When searching for your connection agreement, you may notice that your ODS code isn't showing. This is a common issue. To resolve this, contact NHS England at the email linked below and ask them to make sure that your ODS code is transferred from the CQC database to the connection agreement database, and this is often resolved pretty quickly. The time taken to obtain your connection agreement is dependent on NHS England's capacity to countersign it, so we recommend starting the process as soon as possible to avoid any risk of delay. Once everything is in place, then Cloud Gateway can get your connection set up within 5 working days. If you wanted multiple HSCN connections, you only need to sign one connection agreement for your organisation. You don't need an NHS sponsor to connect to the HSCN. However, you might need a sponsor if you're connecting to services like Spine or EMIS via the HSCN. If you need to connect to the HSCN, the first thing that we recommend is to get your HSCN connection agreement underway, if you haven't already. Further information can be found at our website or just get in touch directly. And then you should find a supplier and speak with them about what you want to achieve by connecting to the HSCN. If you need to find a supplier, there is a published list of CNSP suppliers, including Cloud Gateway, on the NHS England website, or you can just get in touch. So Cloud Gateway can connect your organisation to the HSCN in a number of ways. Through our Health Connect platform, we can connect remote access users, your sites, or your cloud service provider, or we can connect through our Prism platform, which is the UK's first SASE platform. More information about all of these can be found on our website, or you can get in touch and I'll be happy to help. I often get asked how much of the HSCN you can access, and Cloud Gateway can either give you full access to the entire network or lock the connection down to specific IPs and domains. Having access to the entire HSCN doesn't necessarily mean you can access every service. You may need to reach individual agreements with specific providers to consume their services. After contracts have been signed and we've seen evidence of the HSCN connection agreement, we can deploy your service within 5 working days, often quicker. To manage resilience, we maintain diverse routes to the HSCN from our data center presence, which allows us to keep a resilient connection and failover in the event of an outage. Dynamic routing, or BGP, which is Border Gateway Protocol, is used to ensure your connection is maintained, even if one of our data center connections goes down. If you want to upgrade your users' bandwidth or support, you can upgrade at any time during your contract term, and the process is very quick and simple with a small form to complete. The upgraded service will often be live within 48 hours of signatures being received, and we prorate the cost of the upgrade so your contract termination date stays the same. Cloud Gateway provide 2 options for support, Standard and Premier. Standard is Monday to Friday, 9 till 5:30, excluding bank holidays. And Premier is 24/7, 365 for priority 1 and 2 incidents. And then Monday to Friday, 9 till 5:30 for priority 3, 4 and 5. Cloud Gateway can offer 1, 3 or 5 year contracts. Discounts are usually available for 3 and 5 year commitments.